what causes tooth pain, there's kind of three things that can cause tooth pain, all of which have to do with the nerve inside the tooth. The first can be a really deep cavity. Deep decay can reach the nerve, causing it to become inflamed and very, very sensitive. On that same note, if you let that go and it becomes infected, then a tooth abscess can cause that same severe pain. And then finally, breaking a tooth, breaking it to where the nerve is involved. You break it far enough down or up the tooth that the nerve is exposed. That can also be very painful.
Symptoms of a toothache may include tooth pain that may be sharp, throbbing, or constant. In some people, pain results only when pressure is applied to the tooth, swelling around the tooth, fever or headache, a foul-tasting drainage from the infected tooth.
Unfortunately, you cannot always prevent dental pain. Sometimes it's just not up to you. Sometimes the condition just deteriorates into needing to see us. That being said, there is a lot that you can do, and essentially it's keeping a good oral hygiene, so preventing dental cavities and keeping your gingiva, your gums healthy is what you can and should do. And in most cases, if it's done correctly and you visit your dentist regularly so that we can pick up on things before they develop and deteriorate, if you see the hygienist regularly, all these things will generally do the trick, and we can minimize and try and avoid it as much as possible. Additionally, some patients would be just more sensitive, and in such a case, if you have sensitive teeth, you can use desensitizing toothpastes as well, and that sometimes helps. But it's crucially important to maintain a good oral hygiene and to visit your dentist regularly for checkups.
Hi, my name is Jennifer Jackson with Fusion Bodywork in Salt Lake City, Utah. Today we're going to be going over a few acupressure points dealing with toothaches. The first one I want to show you is large intestine 4. To find that one, if you place the thumb into your hand, you'll see this mound of flesh. You can go right at the peak of that, and you're going to go inward towards the bones of this finger and just press. This one is a great pain reliever for all sorts of ailments, actually. Then the next one I want to show you, if you slide up the arm, you're going to go on the thumb side of the arm. You want to be right where the skin is changing color between light and dark. And you're going to go right into the crease of the elbow and press and hold. And then the last one I want to show you is on the face. It's called Facial Beauty. You're going to go directly below the pupil. Let me get you to open your eyes. And you're going to go right under the cheekbone and kind of press upward. This one is an amazing one for sinuses, toothaches, a lot of different ailments in the face.
And today we will be discussing some different ways that one can help treat or resolve some of the pain and discomfort caused by a toothache. Some of the different materials that could be utilized to help treat or offset the pain from a toothache would involve some sort of anti-inflammatory medication such as a Motrin or ibuprofen, and also some sort of topical anesthetic gel such as Oragel or Ambisol. There are several things that can be accomplished to help resolve pain and discomfort caused by a toothache. While it is important to understand that a toothache needs to be treated immediately and one should eventually see a dentist, there are some things that can be used to help combat some of the swelling, tenderness, inflammation, and pain that we see associated with a toothache. The first one that I would recommend would be taking some sort of anti-inflammatory, such as ibuprofen. Ibuprofen is great for two things. One, it helps treat some swelling that can be associated with the toothache, but it also can help alleviate some of the pain and discomfort caused by the toothache. In addition to taking an anti-inflammatory for pain control, one can also use some sort of numbing gel, such as an Oragel or Ambisol. What's done is the gel is placed on a cotton swab and brushed around the gums for about 30 to 45 seconds. And the working action of the gel will help numb the tooth up a little bit temporarily to provide pain relief. And in conclusion, numbing gel and anti-inflammatory medications are great for treating and delaying pain from toothaches.
Natural home mechanisms to be able to care for toothaches. For many, many years, it wasn't available to us to go down to the local rec stall and grab medicinals. A lot of people had to use home remedies, and those are things that you have in your home that you either cook with or various and sundry others that are at your disposal. One of the most common mechanisms to solve a toothache was oil of clove, and it's actually something we still use sometimes in, say, dry sockets and various and sundry other painful syndromes that we have where the bone's achy or painful. It's very good because it helps for the killing of bacteria, and it also improves pain quite drastically. Another is to use garlic clove and to put it down into the area where the tooth is aching. This oftentimes helps. And there are several other home remedies that people have used. Historically, they used to even use bird poop and stick it in the area where the cavity was. And a lot of it's just mechanical, trying to cover up where the nerve is. But these were old mechanisms to try to improve pain and help take away toothaches and pain.